So today we are going to do the record blocks, and that involves the making of the record base as well as the occlusion rim. Both together will be the record block. There will be a step that is needed for the jaw relation procedure. Okay. So I have my two casts here. I have wet them, and I'm going to use light cure acrylic resin just like I used before. I'll use some for the special tray, if you remember. So I'm just going to use the same material. I'm going to make the record base. For my upper, as you can see, there are not many undercuts, and I want to make a record base for this. Slightly in this region, you see this region, like this, slightly in this region there is some undercut, and I want to close this undercut up slightly with wax. Now the main thing is, if there is an anterior undercut, you really don't need to use wax, but here correspondingly I do have a slight posterior undercut as well. So preferably I will just go for this block and then go for that one. Alright, so that's what I will do. In the mandibular, at the same time, I do need to block a little bit of undercut in this region and then a little bit in this region, so that doesn't block out my record base. So I'm just going to use this wax a little bit. I have my flame here. Just zoom in a bit so you can see what I'm doing. Yeah. Okay, so I have my wax. Just going to, okay. The wax, I just want to put some if you remember, like I told you last time, you don't want to allow the material to flow into the vestibule. You don't want it blocking out your vestibule. You just want to close out the undercut. So once I've done this, okay, so you can see what I've done. So I've done this, then I'm going to remove the excess material from there. Take a wax carver, just cut it in a straight line so that all the material, all the material that's in the vestibule goes out. I don't need this wax. Okay, so that should be fine. Okay. So having done that, and I just do this as well. I can move this away then. Take this one. Yeah, same story. As I told you before, hope you can see that. As I told you before, I don't want any material in my vestibule, so I'm going to remove the material from my vestibule as soon as it is ready to be, it's reasonably set. Some slight undercuts in this anterior region. Put a thin layer just to keep it off too much pressure. The acrylic tends to be a bit hard, so it tends to impinge upon the areas that are in the undercuts and starts to pain the patient. Okay, I want to remove all this wax. That's why you wet the cast, so that any excess wax can be easily removed. And here, you want to remove this, like I told you before. You want to remove this, it's very easily done. Go in a bit there for you, so you can see what I'm talking about. Yeah, you just cut this, keeping this blade flat so that the undercut is covered, and you take off this. Yeah, that's it. That's about it. Alright, same thing on this side. Same thing on this side. You want to cut it like that, keeping your blade flat so that the undercut is closed and the material is removed. Alright? Okay. So now we'll go back out. Right. So now you're going to work at the... Let me just close this one. Just adapt this. Now the difference between record base and special tray is that there should be no space. It should be adapted all the way to the vestibule and no space between the vestibule or the tissue reflection point and the tray. So you want to tug it in with the back of an instrument, maybe. Maybe first you want to just cut off the excess. This time you should be careful cutting off the excess because you need some material into the vestibule. Okay. Tug it in. One of the things you must be careful about this is that you want to remove any undercut areas in the land area that you have developed, so that it doesn't interfere with the removal of the acrylic once it is processed. Done that. Place it in. Place it back there. You can see what I'm doing. Alright. I'm trying to fill in the entire width of the vestibule as well. And here, of course, in this region I have a small gap. Put a small piece there into this region. Yeah, I'm going to cut off this. Okay, I'll tuck it in. See what I'm doing? Putting in a little bit of material in this region, tugging with the back of my instrument. See? See that when I'm sorry, yeah. You can see how it is. You can see how the vestibule is showing. Yeah, you can see how the vestibule is showing. And I want to fill up that side so that okay, let me see if I can get it from this angle. Yeah, you can see that. You can see that. I want to just put in some material there so that thin amount of material like this, right? I want to just put it inside here. I want to tuck it in. So I'm not actually trying to get the entire width of the thing because sometimes that becomes a issue, all right? And I'm going to cut off this as well, this end. Cut off this end as well. There is a problem at times of the occlusal tool not able to stick to the record block. I like to solve that problem. I don't like to put grooves. Some people put grooves on it. I don't like to put grooves because it becomes thin at times. I'd rather like to put a small, thin spaghetti shaped acrylic piece more towards the palatal section so that it doesn't interfere with my teeth placements eventually. Just small stuff like that so that my wax can hold to it. Alright. And as before, I like to just tuck it in so it kind of sticks to the record base and forms a little bit of an undercut for me to hold my wax. Just like that. I like to keep it flat. I like to keep it flat, so I like to use a small wax trim to just keep it, press it a bit so you get a flat surface, right? And I like to keep it flat like that. So I'm done there. My wax, I hope the wax will adhere to this because of the grooves and whatever, and I can put, if you want to put some grooves, you can put some grooves on this. Yeah, so that it stays. Now this goes into the light box and cures for about 5 minutes first, and then you want to take it out and have a look at it and then see how it goes, just like the special tray. As it comes to the mandibular, same story. I'm going to just adapt my record base, take some record base, just like we did for the mandibular special tray. You want to adapt it. Okay, want to hold in the center, put it over the sides there like that. Just turn this a little bit so you can see it better. Yeah. Oh, yeah, alright, that's good. Alright, so then you want to put want to remove some material from the center so that you have the tongue space in your record block, and then you want to adapt it into the space, right? You want to adapt it into the space with an instrument. Okay. Cut off the excess from the outside. But you want to tuck it in there. So you want to tuck it in into the vestibule. I hope you can see what I'm doing with the light. Alright, please. Okay. So here also you want to tuck it in with the excess material. Tuck it in. You have to clear the tremolo pad area. Okay. So in the lingual area also you want to tuck it in. It fills up especially the lingual vestibule part. The lingual vestibule here is open. I want to tuck it in so that okay, off there. You want to put a little bit of thin material right there. Okay, so you've gotten that. Get a little bit of material out here. Anterior segment also slightly missing. Yeah, so you want to tuck it in there as well. Once this is done, I like to add a little bit of my favorite spaghetti. I'm just joking. Don't call it spaghetti, please. Small, thin strip of acrylic so that the